Today, we meet to discuss the President's fiscal year 2027 budget for the U.S. Department of Health and Human Services. And thank you, Secretary Kennedy, for joining us. Mr. Secretary, last year during your nomination hearing, I noted our healthcare system was on an unsustainable, dysfunctional path. As costs for patients and taxpayers soared, outcomes and access continued to decline. I suggested these challenges presented an opportunity to chart a better way forward. Although much work remains, we have made significant progress. For too long, Medicaid's financing and programmatic oversight was on autopilot. Coupled with pandemic-related increases and costly regulations under the previous administration, Medicaid spending, and hear this, doubled between 2019 and 2025. The Working Families Tax Cuts took significant steps to realign our healthcare system, strengthening access for those in need, putting patients back in charge of their care, and providing overdue reforms to curb waste, fraud, and abuse. The law prohibits coverage of certain non-citizens under federal health care programs. It removes Medicaid beneficiaries who are deceased, enrolled in multiple states, or own a home worth over $1 million. It also requires individuals who are able to work or volunteer or go to school to do so to be able to be eligible for Medicaid, a requirement that mirrors similarly intended safety net programs. These common sense reforms, along with policies to prevent financing gimmicks, will save taxpayers hundreds of billions of dollars and ensure Medicaid's long-term sustainability, ensuring the program's dollars reach those for whom it was intended. Under the Working Families Tax Cuts, Americans will keep more of their hard-earned money and have greater control over their health care. The law expands access to health savings accounts so that patients, not insurance companies, can choose the health care that is right for them. Individuals with high-deductible health plans can also rely on telehealth services without meeting minimum out-of-pocket payments. Republicans also made a historic $50 billion investment in rural health care through the Rural Health Transformation Program. Beginning this year, all 50 states are receiving funds from the program, which will be used to bolster workforces, invest in connected technology, and promote preventive health interventions. Working in partnership with Ranking Member Wyden, the Finance Committee delivered on our commitment to bring transparency and accountability to the prescription drug supply chain through pharmacy benefit manager reforms. The bipartisan law will end perverse incentives for PBMs to steer patients toward higher-cost drugs and vertically integrate pharmacies. Our work to address anti-competitive consolidation is just beginning, and I look forward to continuing these efforts with Ranking Member Wyden and all members of this committee. On a bipartisan basis, we also extended Medicare coverage of telehealth and hospital at-home services. Insured Medicare Advantage plans maintain accurate provider directories and removed Medicaid barriers to high-quality, specialized health care for children. These extraordinary accomplishments will expand choice and lower costs for all Americans. Mr. Secretary, under your leadership, HHS has also taken sizable steps to fix the failures in our healthcare system that frustrate both patients and providers. Together with the private sector, the administration is breaking down the bureaucratic obstacles that for too long have been accepted as the norm. HHS is reducing health insurers' cumbersome overuse of prior authorization, which routinely delays care delivery. Through Trump Rx, patients can shop for lower-priced versions of their drugs, covered especially by those that are not covered by many insurance plans. I appreciate your commitment to making America healthy again by empowering patients with the tools and information they need to create a healthier future. Under your leadership, the department has focused on addressing root causes and prevention of illnesses. Now Medicare is becoming a system that invests in the whole person, in lifestyle interventions, and our medical schools are equipping providers with the education to deploy these services. Thank you for that. Mr. Secretary, I look forward to learning more about how we can work together to build on the progress we've made in the last year to put patients at the center of our healthcare system.